if we're talking about optimizing patient outcomes, which is what we all want to do, I don't care who you are. It doesn't matter if you're a doctor, therapist, dietitian, a trainer, you want the best patient outcomes. And what does that do for you as a clinic? The better your outcomes, the better your reviews, the better your word of mouth. You're doing business well by doing things that equate to better outcomes. So in all, optimizing patient outcomes depends on what? Comprehensive multidisciplinary care. When you have multidisciplinary care, we're including nutritionists or dietitians, we're including exercise support, we're including behavioral health support. So that would be the multidisciplinary care, and that's what makes a program holistic. So the more and more you hear the word holistic, that's what we're seeing in a trend right now. And I don't want to say it's a trend, it is a trend logistically, but more and more obesity medicine providers are wanting holistic care. But that does not mean you slap it on your website and say, we offer nutrition support and trainers and this and that. And we talk to them and they don't at all. So it's very difficult, we know, to find a way to adopt holistic care in your office without it being bukus of money or a huge financial investment or time. So what they're needing is personalized plans. Big one, accountability and support. They have to have accountability, someone to answer to, someone to follow up with them. Education and empowerment. Without that education, they are not empowered. They're dependent on other systems outside of the real world. Data-driven care, and then most importantly, lifelong maintenance programs. We don't want to focus on them while they're just taking the medication. We want to actually roll them into something that's going to be supportive to them long term. So some kind of program or some kind of support system that does not go away. So observations. I'm taking my decade of clinical experience and nutrition counseling, which I can say I spent 30 minutes to an hour with each one of my patients when I was in bariatrics. And I truly studied and observed these patients and collected their feedback. When I first came onto this program where I worked, there was not an existent program. People were coming back with the most crazy struggles, and I had to ask why. And let's say 3 years later, our patient base grew by 200% because we were getting such good reviews, good word of mouth. There was a structured program people could follow. They were no longer lost. We saw phenomenal results, and this is exactly what we want to offer to the obesity medicine space. Also, it's much needed. So number one, they need guidance. So I learned patients needed clear direction on where to begin, meeting them where they're at, number one, and how to actually progress gradually. Education. So patients require foundational knowledge to replace misconceptions, and misconceptions meaning what they've learned about carbs in the past, what they've learned about this food, it's bad, don't eat this, don't eat that, or fat is bad, or I follow this diet. We want to get that out of their mindset, basically. So we want to replace those misconceptions with fundamental knowledge, evidence-based facts about nutrition, exercise, and behaviors. Number three, practical tools. Without these, things don't happen. Patients need actionable how-to strategies for even preparing their day, creating systems for consistency, building lifelong habits. So we're talking workbooks, worksheets, templates, tracking methods. These little things add up to those big changes that we want to see in our patient outcomes. They have to be taught how to do it. Accountability. This is the biggest one. Consistent support and accountability are crucial. This means between your clinic visits, they need to have a place or a person or something to be accountable for the goals that they're setting for themselves or that you're helping them set in clinical visits. So consistency with support and accountability are crucial. And mostly the insights I gained, I just really truly understood and learned what patients needed, what they wanted, what they would use, what they wouldn't use. And all of this let me understand what was most effective in driving their success, not only with weight loss, but literally spilling into their entire lives.